It's that open enrollment time of year where you can enroll or change your health care plans and find the right one for you and your family. It can be overwhelming, the process, and this is your once-a-year opportunity to make the changes you want for the year ahead. So giving us tips on how to pick the right coverage is Kent Lewis with UnitedHealthcare. Thanks for joining us, Kent.
Thanks so much for having me today.
So for seniors and other people who are enrolled in Medicare, why is annual enrollment such an important time?
Yeah, the AEP annual election period is between October 15th and December 7th every year. And this is the time of the year that someone with Medicare gets to choose the plan for 2021. So it's important to look at the options in the market, look at your current plan and see where you're at, because plans change from year to year. For example, UnitedHealthcare, we had a big change on our Medicare Advantage plans for 2021, where we have our insulin covered at a $35 copay for flat copay for insulin instead of what it was before. That's about a $450 savings per year for the average person. So it's important to really put yourself in the best shape possible by looking at the options during this window of about 7 weeks.
And a lot of times people do get overwhelmed. They're looking at different plans, comparing all the different benefits. What advice can you offer, I should say, to help make that process of choosing a plan easier?
Yeah, the best thing really is to look at your current plan, see where it's at. Every year there's an annual notice of change sent out, so you get to see what your plan is going to change to for 2021. That puts you in the driver's seat to compare against the options in the market, and maybe there's some benefits or prescriptions that you wanted to have covered different. This is the time to look at that. But also, we can help. UnitedHealthcare is here. We have agents available by phone, through our internet. We have a chat feature, through our website, as well as even in person with COVID precautions, of course, to make sure you're in the best position possible for 2021.
Now, when you're looking at the Medicare plans that you can select, it can have a significant impact on your health and well-being. So what are some of the things people should look for in their Medicare plan to stay healthy, especially when we talk about things like COVID-19?
Yeah, one of the things we saw this last year, which was a surprise, of course, to everybody, was COVID coming in March, right? It was interesting because UnitedHealthcare, we added the virtual medical visits for 2020, having no idea that come March people were going to use it so much. So we went from about 150 doctors treating patients to having to ramp up to about 14,000 treating patients to meet that demand there. And really, it's a great tool. So when looking at 2021, it's good. It's important to make sure that's covered. Usually it's a $0 copay for that benefit. And that can help out supplement, but it doesn't replace that time with the doctor. A lot of people, we're seeing 40% of people not going to the doctor in 2020, putting things off. And we know prevention is key and really is important to get that taken care of, because early detection is better result in better results at the end there. So I definitely want to make sure everybody's doing that. But you want to be in a position to have the best possible health for 2021. Look at your current plans and see if there's some extra benefits, like maybe a fitness membership that can help as well.
Yeah, you definitely want to be prepared, because we just don't know what's coming next year. Now, Medicare Advantage, it's one of the options people can consider, and I understand it has experienced rapid growth in enrollment over the past few years. Can you explain what it is and what's driving that growth?
Yeah, Medicare Advantage, we've seen it's right, a 40% increase over the last 5 years of people choosing a Medicare Advantage plan. We're at now 1 out of 3 people with Medicare choosing a Medicare Advantage plan. And part of the reason is this. One is the Medicare Advantage, it has hospital, doctor, prescriptions all in one low premium plan. Plus, it has a lot of extra benefits included that aren't usually covered with Medicare. Like I mentioned, the Renew Active Fitness membership, the virtual visits, but also things like hearing aids, vision, and other coverages that typically Medicare doesn't cover. In the case of UnitedHealthcare, we have all 3 options available for Medicare Advantage, as well as Medicare Supplement and prescription drugs, because we know that one size doesn't fit all for everybody.
Yeah, and as people get ready to make these decisions about Medicare coverage in the coming weeks, any resources they need to know about if they're looking for some help or support as they make decisions?
Yeah, definitely. We have, like I mentioned, we have a toll-free number that's available to help people out. That's 1-800-978-9977. We also have our website with the chat feature. You can ask questions and a representative can help out. That's uhcmedicarehealthplans.com. And again, we have agents in all of the communities in Northern California that can actually meet in person with the COVID precautions in mind to make sure you're in the best possible position. Our number one goal is to make Medicare easy.
All right, Kent, some great information there. I know a lot of people will find it helpful. Thanks for joining us this morning. For more on how to understand healthcare benefits, go to knowmedicare.com.
This interview involves commercial content. The products and services featured appear as paid advertising.